Goodpasture Syndrome is an autoimmune disease Look at this picture, shows the disease mechanism, pathological, CT findings, MRI and chest X-ray findings. Detail going on. Introduction. Goodpasture Syndrome is a rare autoimmune disorder characterized by the presence of circulating autoantibodies that attack the basement membrane in the lungs and kidneys, leading to severe damage in these organs. Primarily affecting young men, though it can affect women and people of any age. Goodpasture syndrome is associated with pulmonary hemorrhage and rapidly progressive glomerulonephritis. A definition. Goodpasture syndrome, also known as anti-glomerular basement membrane disease, is an autoimmune condition in which the body's immune system mistakenly attacks the kidneys and lungs. This attack is due to autoantibodies targeting a specific type of collagens, type 4 collagen, found in the basement membranes of the organs. Types 1. Classic Goodpasture syndrome involves both kidneys and lung involvement with glomerulonephritis and pulmonary hemorrhage. 2. Renal limited Goodpasture syndrome only affects the kidneys with no lung involvement. 3. Pulmonary limited Goodpasture syndrome. Rarely, this form involves only the lungs with no kidney manifestations. Causes. The exact cause is unknown, but factors believed to contribute include 1. Genetic predisposition, 2. Environmental triggers such as infections or exposure to hydrocarbons or tobacco smoke. 3. Exposure to certain medications that may alert the immune system. Risk factors. 1. Family history of autoimmune diseases. 2. Smoking or exposure to chemical weapons and hydrocarbons. 3. Viral infections such as influenza. 4. Genetic susceptibility. Example HLA DRB1 gene mutations. Complications: 1. Kidney failure, end stage renal disease. 2. Pulmonary complications such as recurrent hemorrhages. 3. Increased susceptibility to infections due to immunosuppressive treatment. 4. Psychological distress due to chronic illness. Pathophysiology: the primary pathophysiological process in Goodpasture Syndrome involves the formation of antibodies targeting the A3 chain of type 4 collagen found in the glomerular and alveolar basement membranes. These autoantibodies bound to the basement membrane, initiating an inflammatory response and damaging the affected tissues. This leads to glomerulonephritis in the kidneys, causing hematuria, proteinuria, and potential kidney failure. Alveolar hemorrhage in the lungs, causing symptoms like hemoptysis, coughing up blood, and respiratory distress. Goodpasture Syndrome step-by-step pathophysiology. 1. Genetic and environmental triggers. 2. Autoantibody production. 3. Binding to basement membranes. 4. Activation of the immune response. 5. Inflammation and tissue damage. 6. Clinical manifestations. 7. Progression to organ failure. Without intervention, continued antibody production and immune mediated damage lead to progressive loss of kidney function, resulting in end stage renal disease. Signs and symptoms. 1. Pulmonary symptoms: cough, bloods, hemoptysis, shortness of breath, fatigue, and chest pain. 2. Renal symptoms: hematuria, blood in urine, proteinuria, hypertension, swelling in leg or feet, decreased urine output. 3. General symptoms: fatigue, pallor, and unexplained weight loss. Diagnosis: 1. Clinical history and physical examinations, assessment of respiratory and renal symptoms. 2. Laboratory test, detection of anti-GBM antibodies in the blood. Urine analysis to check for blood and protein in the urine, and blood test for renal function. To imaging studies, chest X-rays or CT scan may reveal lung hemorrhages or other abnormalities. 3. Kidney biopsy confirm glomerular basement membranes damage and the presence of immune deposits. Nursing diagnosis. 1. Impaired gas exchange related to alveolar hemorrhage. 2. Acute pain related to inflammation in kidney or lungs. 3. Risk for infection related to immunosuppressive therapy. 4. Anxiety related to chronic illness and treatment side effects. Management. First, medical management. 1. Immunosuppressive therapy, corticosteroids and cyclophosphamide are used to suppress the immune response. 2. Plasma pheresis removes circulating antibodies from the blood, helping reduce kidney and lung damage. 3. Renal support. Dialysis may be necessary if there is severe kidney damage. In nursing management, 1. Monitoring. Regularly monitor respiratory status, kidney function and lab values. 2. Medication administration. Educate the patient on the importance of adherence to immunosuppressive therapy and monitor for side effects. 3. Infection control. Provide instructions on avoiding infections, including hand hygiene and avoiding crowds. 4. Emotional support. Offer psychological support, encourage family involvement, and provide resources for coping with chronic illness. Treatment options. 1. Immunosuppressive medications, corticosteroids, immunosuppressants like cyclophosphamide. 2. Plasma pheresis, often performed daily or every other day to quickly reduce antibody levels. 3. Dialysis for patients who develop end-stage renal disease. 4. Lung support. Oxygen therapy for respiratory diseases or ventilatory support if necessary. Psychosocial medicine. Living with Goodpasture Syndrome can be challenging, both emotionally and physically. Patient may experience anxiety, depression, and uncertainty about their prognosis. Support from family, friends, and counseling services is essential. Group therapy or connecting with others facing similar conditions may provide comfort and help in coping. Here are important social medicines relevant to managing and supporting individuals with Goodpasture Syndrome. 1. Access to healthcare and financial support. 2. Mental health and psychological support. 3. Patient education and empowerment. 4. Community support and advocacy. 5. Workplace and lifestyle accommodations. These social medicine considerations provide a holistic approach to managing Goodpasture Syndrome. Helping to improve patients' quality of life and provide the necessary support for navigating the challenges of this rare disease. Prevention. There is no known prevention for Goodpasture Syndrome. However, reducing exposure to potential triggers such as smoking cessation and avoiding harmful chemicals may reduce the risk of developing or exacerbating the condition in susceptible individuals. Here are preventive measures. 1. Avoid smoking. 2. Limit exposure to harmful chemicals. 3. Practice respiratory health hygiene. 4. Early detection and management of symptoms. 5. Minimize use of certain medications. While these measures may help lower risk, Goodpasture Syndrome cannot be entirely prevented due to its autoimmune nature. Preventive strategies focus on minimizing potential triggers and protecting overall respiratory and kidney health. In conclusion, Goodpasture Syndrome is a serious autoimmune disease that requires timely diagnosis or intervention to prevent severe complications. Although treatment can improve the prognosis, it often involves lifelong management, especially if there is reversible kidney damage. Though comprehensive care, including medical, nursing, psychosocial support, individuals with Goodpasture Syndrome can achieve a better quality of life. Thank you. Have a nice day.